Hi guys, this is Dr. Ed coming to you from London, England, where I'm here to treat one of my patients, hopefully trying to avoid surgery since he's being treated only by Western medicine and they want to put tubes in him. So we're hoping to integrate his care and decrease it. But we happen to be here and with my lovely fiance here. Say hi.
Hi.
And we happen to be here and today is Gay Pride Parade. So I wanted to, attach something important, an important message, to this, which is let's talk about measles versus suicide and how this is connected to perhaps this day. So suicide is the #2 cause of death in the United States for young people. 10 to 14-year-olds, there's over 500 kids who die every year. And from the 15 to 24-year-olds, you have over 6,000, and it goes much higher after that. So, what does this have to do with anything? Well, in America, we want to save lives, and for some reason, most of our focus goes towards one thing, which are vaccines and measles and the fear of death, regarding that. So if you look at the last child who died in America, with measles was 2003. That's 16 years ago. And yet we have this massive, massive problem of children dying every day, more than one a day, from even the 10 to 14-year-olds. It's crazy. And yet, where is that in our media? Where is that discussed in our society? Everything is hijacked and laws are sent, pulled through, and everyone's fearful of, some viruses, mostly that are self-limiting. Of course, it's not for everyone. You can cause bad pneumonia. You can be hospitalized. You can even get that rare encephalitis that everyone fears. But those are rare. And here we have a massive problem that's not being addressed. So on this day of walking here, seeing all these people, straight and not straight, going around, you have to sort of say, why is there such an unbelievable, terrible, what I would call true epidemic that's not being addressed? And the Gay Pride Parade, the reason I thought about this is because that's one of the common reasons of severe depression and anxiety in young people. So if you look at that young age group, it's very, very sad that, that it caused such mental illness that, a lot of kids end up taking their own lives. So for me, I want everyone to realize that we really should focus on the right things, trying to help. If we want to save lives, let's focus on the true problems. Your #1 problem, of death is accidental death. That's relatively hard to completely control, although we can do a lot of things about that. #2 is suicide. And #3 is homicide. And these are very, very big problems that we're not focusing on. If you look at measles death, it's 0. And if you look at whooping cough deaths, it's 0. So instead of, changing our laws and removing our personal freedoms, let's really focus on the true reasons. I'm trying to understand and help people with mental health illness. And that is when our society will truly focus on care rather than what's happening right now, which is losing freedoms and, changing subjects and making people fearful. So from London to us, we love you. Do we love them?
I do.
We love you guys. Please spread the message. Understand that we really need to focus on the right things, and God willing, we will one day. We're out.